And a busy day on Capitol Hill yesterday as lawmakers on both sides of the aisle pressed Dr. Casey Means, President Trump's nominee for Surgeon General, on topics ranging from vaccines to birth control to her background and expertise. Means, a Stanford-educated physician turned wellness influencer who dropped out of her residency and does not have an active medical license, appeared before the Senate Health Committee, which will now decide whether to advance her nomination as the nation's top doctor to a full Senate vote. Republican Senator Bill Cassidy of Louisiana, who's the chairman of that committee and a doctor himself, grilled Means on how she would approach vaccines. Watch.
Would you encourage other mothers to have their children vaccinated against measles with the MMR vaccine?
Like you, I'm a physician. I believe vaccines save lives. I believe that vaccines are a key part of any infectious disease public health strategy. And I would work with you, the CDC, the NIH, ACIP,
but would you
FDA.
encourage mothers to vaccinate their children with the MMR vaccine, seeing how we've had children die in this outbreak in South Carolina?
I'm supportive of vaccination. I do believe that each patient, mother, parent needs to have a conversation with their pediatrician about any medication they're putting in their body or their children's bodies.
You're the nation's doctor. Would you encourage her to have her child vaccinated?
I'm not an individual's doctor.
A child about the age of your child dying from a vaccine-preventable disease. And some have been scared to vaccinate their children because they've been told incorrectly that vaccines cause autism. Do you believe that vaccines, whether individually or collectively, contribute to autism?
Senator Cassidy, you're a physician. I'm a physician. The reality is that we have an autism crisis that's increasing. And this is devastating to many families. And we do not know, as a medical community, what causes autism. Until we have a clear understanding of why kids are developing this at higher rates, I think we should not leave any stones unturned.
There's been a lot of evidence showing that they're not implicated. Do you not accept that evidence?
I do accept that evidence. I also think that science has never settled.
There were a lot of moments where there could have been clear answers from the person who wants to be the nation's top doctor. And she didn't give them to the top senator on that committee, who is a physician himself. Also notable, Democratic Senator Patty Murray of Washington pressed Means on her past comments about birth control pills, which the nominee has called in the past a disrespect of life. Watch.
Help me understand. Should women trust the FDA, which approved all 18 methods of birth control after a very rigorous look at the evidence? Or should they trust your statement that there are horrifying health risks to birth control, which contradicts that evidence?
I'm curious if you're aware of what the side effects of hormonal contraception are.
I'm curious if you are with the FDA that went through all of these and rigorously looked at them, or as Surgeon General, if you're going to tell the truth to the American people.
I absolutely believe these medications should be accessible to all women. And also, all medications have risks and benefits. And in our current medical climate, with the burden on doctors, doctors do not have enough time for thorough informed consent conversations. Some of the horrifying side effects of birth control that I have mentioned include blood clots and stroke risk in women who have clotting disorders, who are smokers, who have obesity. No, it's not general. I'm very careful with my words.
Doctors are transparent about those side effects, by the way. Let's bring in MS Now reporter Will McDuffie. Will, you were at this hearing yesterday on the Hill. I wonder if we can start with Senator Cassidy, who I'm always fascinated by, especially because his line of questioning on vaccines was very similar to the one that he gave to RFK Jr. He had skepticism, well reported at the time, about RFK's nomination. Ultimately, he voted to confirm him to be the head of HHS. Now you've got an RFK Jr. ally here in Casey Means, not giving clear answers on vaccines. Did Cassidy say anything after the hearing? What stood out to you about that line of questioning and Means' answers here?
Hey, Allie, I tried to catch him during a break in the proceedings shortly after that line of questioning, and he said, I'm not ready to talk now. I need to talk to my staff. We haven't really heard from him since, but I will say, Allie, if you're going to be a top health official in this administration, you got to be ready to talk about vaccines. And I thought that exchange in particular was really telling, not just because Cassidy's a physician who has clashed with Kennedy on vaccines, but also he made this point. if Casey Means were to become Surgeon General, she would be the nation's doctor. And that is the key role of Surgeon General, to message about public health to Americans so that they know how to go about their lives, what sort of, medications, how they can, take care of themselves. And so that answer that I'm not anyone's individual doctor. Well, she's a nominee for a role that would allow her to be kind of that messenger. And I will say, Dr. Oz just a couple weeks ago, who leads CMS, said very clearly, take the measles vaccine. She wasn't able to say that yesterday.
Yeah, she wasn't able to say that yesterday, and I think that that's really important. It leads to the question that I have about Senator Cassidy when I get back to the Hill, which is ultimately he fell in line with Republicans when it came to RFK Jr. It overcame the skepticism he had. Is this now the moment that he lays down a marker and says, as we've seen this HHS muddy the waters, not be clear, not be direct with Americans about the vaccines that they should be taking? Is this his moment to take a stand and not help this nomination advance to the full Senate? I think that's one question. And then I think the other piece of this is for an administration that is part of a conservative movement that has tried to come after birth control and birth control means, things like mifepristone and mifepristol, the abortion pill. Is there anything notable about the way that Casey Means has talked about reproductive health care and the things that are available to women? We played Patty Murray there, but what stood out to you about those lines of questioning? Because it wasn't just Murray who asked about it.
Yeah, one quick thing about Cassidy. He's going to be so fascinating to watch. He's in a competitive primary now against someone who was just endorsed by President Trump and who also is getting $1 million from a group that backs RFK Jr. The tension between Cassidy and Kennedy is real, and we'll see if it manifests at all in his vote on Casey Means. And I agree, the birth control answer was fascinating, and Patty Murray was not the only person to press her on that. I don't know exactly how that's going to play in terms of the administration, in terms of the MAHA movement. Something else to watch out for, Allie.
Yeah, and I've asked key HHS officials as well about what kinds of reviews they are undertaking. They've said previously that they are not going to try to review mifepristone, which is FDA approved and is safe. And yet I think there is still this looming question from reproductive health care advocates about what and if the administration is going to do on that front when it comes to abortion and when it comes to birth control more broadly. I think if we just take a step back too, the hearing is fascinating for all of the political dynamics that we have talked about. But then there's also the ways that other doctors, people who have been Surgeon General, including Trump's first Surgeon General, have said that they don't think that Means has the qualifications to do this job. So can you just sort of tease out for us the pushback and why, who she is?
Yeah, you're reading my mind, Allie, because I actually have Jerome Adams' statement in front of me. He was Trump's Surgeon General in his first term. And he tweeted last night, as a former U.S. Surgeon General who held an active medical license and practiced medicine while in the role, it's incomprehensible that the Senate is even considering a nominee for this role who lacks any active license and has never practiced unsupervised. To give a little context on that, Means was educated at Stanford Medical School, but she quit her residency in Oregon before she completed it, and that has drawn some criticism. Her license to practice medicine is current, so it hasn't expired, but it's inactive, which was her choice. She inactivated it. That doesn't disqualify her from being Surgeon General, but it definitely led to some questions, especially from Democrats yesterday. And I'll be honest, Allie, her background, as unique as it is and as critical as some senators might be of it, it's actually what drew her to Kennedy in the first place and to the MAHA movement. She was sort of plucked from that movement, someone who is disillusioned with how medicine is traditionally practiced. That's why she said she left residency. She thought there was too much of a focus from doctors on treating illnesses and not preventing them in the first place. And there was a lot of MAHA activists, if you will, who were on Capitol Hill yesterday to support her.
Yeah, a lot of them who were on Capitol Hill to support her. I also think there was a fascinating exchange with Senator Chris Murphy around the moments where, in her capacity as an influencer, she was posting about certain things on her social media page, but not saying that she was paid to do them as advertisements. Instead, it just looked like she was recommending various supplements. She pushed back on those claims, tried to muddy the waters, but Murphy continued to say that he basically had the receipts. He and his staff had done the work on how infrequently she was putting that things were actually an ad or the financial benefit that she she was getting from recommending it. So I think this is going to be a fascinating nomination, especially as it could be an opportunity for Republicans who have been unhappy with some of the things that RFK Jr. has done, assurances that he made to them that are obviously not coming to fruition. Is this a moment that they take a stand, or are the political dynamics such that they cannot step out of line with the administration? I think you and I are going to have a lot to talk about as we continue covering this. MS Now reporter Will McDuffie, thank you for coming on.